Hi there, and thanks for watching Canceling COVID on this wonderful Wednesday. It's the midweek. We call it Hump Day. I'm Tanya Rivens. I appreciate you taking the time to join us. Join us, that is. This is the place for real people to have real talk and find real solutions. And we're working together to protect ourselves. Of course, it's a pandemic happening, folks, and we've been talking about it every week. Our families, our way of life, this global pandemic continues to impact so many of us, and so many have kind of gotten away from what we started to do that was working. But here we've been talking about this variant, and there are more variants that are expected. So we've got to do our part to make sure we don't go back to where we left behind. And I like to think that we have left that phase of this pandemic behind us. I want to say thank you to our sponsors, Mecklenburg County Public Health, MECCountyNC.gov, MECCountyNC.gov, and Global Groundwater Solutions, that is. Groundwater Solutions, Dr. Trasha Black. She'll be joining us shortly. But let's go ahead and jump in and talk about what's going on. Right now, there are more than 870 new COVID-19 cases in North Carolina. That's close to 1,000, folks, and at least 670 people are being treated in hospitals. This pandemic continues to rob people of their health, their livelihood, and so much more. And what we would like to do, again, is keep this dialogue going, keep the conversation going, so that we can inform you to help make decisions that will help us just improve our lives daily as we continue to work our way to find solutions. So we've got our first guest, Miss Yvette Broussard. She's with Symmetry Behavioral Health Systems. She is going to join us to talk about how I'm having some problems with my teleprompter, my guys. So sorry about that. They're working to help to save the community one family at a time, which is also so important. You know, we've got so many issues that impacted our community, our finances, our schools, you name it. We've been impacted, and we're trying to work through these things, but it can be quite difficult. So, Ms. Broussard, first of all, good afternoon. Thank you for taking the time out of your busy schedule to join us.
Well, thank you so much for having me.
Absolutely. So share a little about Symmetry and your purpose.
Okay, so Symmetry Behavioral Health Systems, we actually we provide mental and physical assistance for the community in Mecklenburg counties. We are also working with the COVID-19 support services from the state of North Carolina and Mecklenburg County as well.
So, Miss Broussard, I don't know if you can adjust your camera just a bit. You're not quite centered, so we've got some ways that she kind of switches up. There you go. Yes, I can see your beautiful face completely. Oh, that's so much better right there. Thank you. I appreciate it. I get turned around on left to right. I think if you'll lean right now to my left just a little bit. Perfecto. There we go. Thank you so much. Yeah. So what has it been like seeing community needs intensify during COVID? Because I know we've seen so much change, and it seems like everybody needs something.
Well, yeah, so a lot of families, you'd be surprised that have been impacted by COVID-19. They're having issues paying their rent, utility bills. They're needing financial assistance and even food. They don't have the access to food. So that's where Symmetry comes in. We are in partnership with KEPRO, and KEPRO is the one, we work together in trying to provide the assistance and to the community.
And we're grateful for that. And thank you for what you all are doing to help bring this assistance around. A big part of what you all are doing, however, is making vaccines accessible with doses going door to door. How does that work, and what has the reception been like?
Okay, so that recently we just had that a couple weeks ago, and we actually assisted the Mecklenburg County Health Department in that effort, the Doses to Doors campaign. We actually went into the South End apartment complex. Prior to us going into knocking on people's doors, we actually disseminated information to the community, knowing to let them know that we were coming into the community, so there wouldn't be no surprise on their end. Unfortunately, sometimes that communication doesn't get to everybody. So there was some surprises at the doors, but reluctantly, we had about 18 people to get vaccinated during that campaign for a couple hours.
Now, that's got to be pretty encouraging. I mean, that's 18. I call that baby steps.
Yes, baby steps. And, and we also think of it as if we get one vaccinated, we're happy, because that's one person that also is vaccinated in the community. So but yeah, 18, it was for me, I mean, for us, it was a great success. We got some lessons learned, some different things, some different ideas. We had a meeting on Friday that we are going to do a different approach. um, but other than that, I mean, people were receptive to it, and some people weren't. We don't push the vaccine on anyone. But we did have a doctor on standby, so if they wanted the vaccine in their homes, we simply call or text the phone number, and they were there within, anywhere between 8 to 20 minutes to get there to the house to get them vaccinated.
That's really good news. And with the numbers going up as far as people getting the Delta variant, and with the numbers that it started to go down with the vaccinations, this obviously is a better option because part of, I would think, what you're able to do also is hold a conversation to answer questions. And even if a person that moment may not want to go ahead and get the vaccine, at least they'll have an opportunity to probably answer some of the questions on why they've been hesitant up until this point. Did you run into that?
Absolutely. There's a lot of myths out there. And as community health workers, we have to debunk those myths because we're properly trained. We trained to how to say things and how to educate people. So one of the biggest things that if we don't get people vaccinated, at least we got them educated on the vaccine, that perhaps maybe down the road they change their mind and then get vaccinated. And that's happened. It actually has happened.
Do you guys expect? You said you're going to regroup and some lessons learned, but hopefully some more teams will start to spread out more in the community in partnership with the county and go door to door. Is that
Or
part?
absolutely, yes. So that's what
Yeah.
we're doing now.
Yeah,
Yes,
'cause
ma'am.
that obviously works. So, Ms. Broussard, what about anyone? You mentioned the rental, utility, and financial assistance, also food. How do these services that you provide? How does it work through Kibra?
So Kipra, so you would call a phone number. Is it okay for me to say the phone number online?
Absolutely,
Okay,
yeah.
so if you dial 704-859-4059, call option one. And we also, if you have language barriers as well, that you don't speak English, we also have an interpreter on the other end as well. You call that number, you let them know that you've been affected by COVID-19, or and you let them know that you need rental or utility. They create like a ticket kind of, and then they send that over to Symmetry. So that's how we end up getting it. And then we have partnerships with the community-based organizations in the community that can actually help them with with whatever assistance they need.
Hopefully, more people will start taking advantage. I know there's been a lot of assistance offered through the city and county, but with the whole moratorium on rent starting to be lifted, I believe the end of this month, I expect you guys will start to get flooded with some more calls. So we appreciate that. Feel free to give out that number again, and even if there's a website where people should go.
Okay. It's if you call 704-859-4 I mean, I'm sorry, 704-859-4059.
859-4059, area code 704. We
Yes.
certainly appreciate it. Any final thoughts, Miss Broussard? Anything else you would like to share?
We're also doing some pop-up events too. So if we can't get to your door, please look for, if you log on to our website at www.symmetrybhs.com, we actually have a list of events in the area that we are having pop-up events. So if we can't make it to your door, you don't want us at your door, you could always, you know, pop into one of our pop-up events.
That's great information as well. So symmetrybhs.com is the
Yes.
website for people to contact you. Thank you so much for taking the time to talk with us. Thank you for the services that you all are providing. And thank you as we continue to work together to cancel COVID and try to make the adjustment back to where we would like to have a new norm as far as our lifestyle. Thank you again and enjoy the rest of your day.
Thank you so much.
Absolutely. Yvette Broussard, everyone, our guest, and certainly happy to have her join us. Symmetry Behavioral Health. And Kipro is one of the individuals I was able to meet and talk to. And they are actually out at some of the county vaccine locations giving out this information, which is a great way to get the information. But there are other ways to keep the community informed, and hopefully we can assist in that manner as well. Now, more than 4,000 fully vaccinated people, and this is in North Carolina, you've got to listen to this, have contracted COVID-19. This is big stuff, guys. 4,000 fully vaccinated people have contacted COVID 19. 61 have died. About half of those cases happened in the last 2 months, and there are two major reasons. The Delta variant, which we've been talking about, it's spreading quickly, and fewer people are socially distancing with masks. We see it all the time, we see it everywhere we go. It's like the pandemic is not happening. And even yours truly, I'm like, well, everybody else, I don't want to be the only one in the room with a mask on, but you're going to have to put that pride down because it's real again. And if you're not paying attention to anything else, you should be paying attention to the fact that the cases are going back up. People are dying again. And for those of you that don't want to be vaccinated, I would say take precautions. You've got to protect, not just think about yourself, but think about the people around you. Think about who in your life that you may cause to get this strain, and you don't want them to suffer like that. And for someone that will hold a real talk, a real conversation, which we love having every week, is Dr. Trasha Black of Groundwater Solutions. She's going to join us and we're going to talk about these numbers. And of course, she's out and about in the community every single day. So, Dr. Black, first of all, good afternoon. It's so good to see you.
Good to
Always
see
looking
you
forward to this
too.
conversation. Absolutely. So, let's jump in and talk about it. You heard the numbers. What comes to mind when you hear these numbers, Dr. Black?
Well, first of all, I just did a big sigh. That is so troubling to hear those numbers, and I think we've talked about it over and over every week that
Every
even
week.
if you're vaccinated, still take the safety precautions because COVID is still out there. And I just see so many people, organizations, businesses that have relaxed those safety measures, and this is the result of that. And so it's sad to hear because these are preventable illnesses and deaths now, whether preventable with the vaccine or preventable with the safety measures. And so we just have to be educated and we have to go back to being hyper vigilant, just like we were this time last year.
And some of the habits that we picked up, they're not bad habits. We talked about that. Now I find myself every time I come inside washing my hands. I find myself using hand
Mhm.
sanitizer. I find myself trying to keep the distance. I think the biggest challenge is trying to keep that mask on or putting lipstick on and then the mask and then it's all over your face. It's like, oh geez. But that's a small price to pay, you
Exactly,
know.
for health.
Yeah.
I have one of my staff members. He said that every year he would get the flu,
Yeah.
as far back as he can remember. And he said, and he has not had the flu this year. He didn't have the flu last year, and he believes that the masking is preventing other infections as well. I think it has really boosted our hygiene overall, the
Mhm.
cleanliness in our restaurants and businesses, because we pay attention to those things now. So I think we've learned that. Let's just keep doing it and to stay vigilant. I have ideas I'd like to share about what each of us should be doing in our home, what kind of protocols we need to reinstitute.
And why don't you share those? And but real quick on the mask thing, I've already said in the wintertime because it was nice to not have the flu and all the yucky stuff in your home. So
Mhm.
I agree with him 100%. But talk about some of those measures.
So the first thing you need to do is really return to not touching your eyes, your nose, your mouth, your ears with your hands until you've had the opportunity to wash your hands with soap and water. So what I do is I keep hand sanitizer in my car, in my purse, in my office. And so if I'm out and about, I go to the grocery store or what have you, I get in my car and I apply hand sanitizer. Okay. Then I leave out where whenever I get in the car or to a new environment, I start with hand sanitizer. And then when I walk in my house, the first thing that I do is go to a sink and wash my hands with soap and water.
Mhm.
Now, I am not as vigilant as some people. Some of the research says that we should actually declothe as soon as we walk in the house. Definitely leave your shoes at the door because COVID will travel up on the bottom of your soles of your shoes. So leave your shoes at the door. Go to the kitchen, bathroom, wherever you have the closest sink, and wash your hands with soap and water. Even when I use sanitizer, when I get in the car, when I get into a physical location, I go and wash my hands. Okay, declothe. There's certain vitamins and nutrients you should be taking. Each of us should be taking vitamin D. Getting outside as well, getting sunshine every day, because that is one way to battle COVID infections. If you have it, or even if you have COVID, get outside of your house. Go get sunshine every day. Sit in your backyard, front yard, walk around. We had a doctor on here, and I've actually started telling the individuals to take oil of oregano. Oil of oregano is wonderful for all illnesses. It helps with inflammation. It boosts your immune system. The doctor that was here some months back talked about how his entire team of nurses and physicians had not experienced COVID-19 and believed that the oil of oregano was helping. So
Hey,
just
Dr. Black, talk about on that for a minute. So I thought he said wild oregano.
it is wild. It's oil of oregano or wild oregano. It's
And
really
how do you take it?
it can come in liquid where you can have drops under your tongue. It comes in capsules. I can tell you a quick story. So that day when I heard him on the show, I went to one of the local health food stores and I got the oil of oregano, and I actually ended up with COVID in January of this year. And it really helped boost me and where I wasn't sick for a very long time. And then after I ran out of that in 90 days, I ordered a reorder of a new brand on Amazon, just reading the reviews. Well, this one is different. I can taste it. I in my mouth. Hours later, I taste the oil of oregano. But Tanya, I sleep at night. For 20 years, I had not slept through the night. Every night I sleep. I go to bed at night. I do not wake up until the sunshine comes in.
So that's good information, and it's good for people to know, because oftentimes people that are hesitant, again, they want to know of whether some other options. And we are just trying to educate everyone, give you the information to help you. So that's nice to know, because I've been hearing a lot about vitamins and the impact that they can have.
And I think whether you're vaccinated or unvaccinated, boost your immune system.
Absolutely.
It's very important. Eat healthier, exercise, get the sunshine. That's what's going to keep you healthy long term.
And that's what I worry about my son and these young teenagers, boy. They'd rather eat out all the time, and it's just not giving them the nutrients that you get from home cooked meals. But right now, there's a big debate also, which is a good segue, talking about students. Parents, of course, concerned. Our children are getting ready to head back to school. A pediatric group says that all children over 2 should wear a mask at school. Some argue that masks should be the parents' choice. What's your advice on that?
I believe that children should mask. Well, of course, I believe adults should mask. My grandchildren just this week had an exposure at their daycare. So the daycare is closed. And there are children and teachers who are infected. So I think that we have to protect our children. And I think I see the cute little children walking around with masks. They are getting used to this as well. So I think it doesn't hurt them. I think facilities have to set the rules for their facilities. And I think parents have to honor that, and they should want to keep their children healthy.
And I think it's the parents that are the problem. The kids will make the adjustment, they will adapt, and then we all would be a lot happier. And that's a great question. I see some of you hopping on, and we've had great conversation throughout the show. But if you'd like to weigh in on whether you think children should wear masks or not, I think that obviously there's a benefit in it. We've benefited from it. That's how we've been able to get where we are at this point. And as students return to school,
most of the children are unvaccinated. So that means where the virus is present in our communities, in our society, and we know that we're more at risk if we don't have the vaccine. And so if we're going into a childcare where the majority of individuals, if we're going into schools where the majority of folks are unvaccinated, we know the virus is there already because that is the nature of COVID, then we have to do something and put some mandates in place that